Good day, health warriors. This is Althea, and in this presentation, I will tell you about the main differences between hypothyroidism and hyperthyroidism. The symptoms and signs, diagnoses, treatments, complications, causes, and recommended foods will be the main focus of discussion today. Although hypo and hyperthyroidism are multifaceted in spectrum, Hashimoto's thyroiditis and Graves' disease are the two conditions that will be highlighted in the discussion. Please watch the video to the end, and I promise you, at the conclusion of this video, you will know how to differentiate these two conditions, starting with the signs and symptoms. So the signs and symptoms for hyperthyroidism are nausea, vomiting, diarrhea, swollen thyroid glands, prominent eyes, metabolism, tachycardia, hypertension, hand tremor, profuse sweating, hot flashes, mood swings, or being wired, weight loss, irregular periods, and so on. For hypothyroidism, which is also noted as underactive thyroid, there's fatigue, increased sensitivity to cold, constipation, dry skin, weight gain, puffy face, hoarseness, muscle weakness, elevated cholesterol, and I think sometimes swollen thyroid glands too. Okay, so those are the main signs and symptoms. Here are the causes of hyperthyroidism. So first, hormone overproduction, excessive iodine intake, tumor, for example, thyroid gland tumors. Other tumors may be, for example, ovaries, testes, and pituitary glands. Familial, meaning it's inherited. Chronic diseases such as diabetes type 1, pernicious anemia, and adrenal insufficiency. So those are the predispositions for coming down with hyperthyroidism. For hypothyroidism, decreased hormone production, namely the thyroid hormones T3, T4, and increased TSH. Aging, females, so females are more prone and they start having thyroid issues postmenopausal and sometimes middle age. Autoimmune diseases, treatment of hyperthyroidism. So as a result of getting the medication to treat hyperthyroidism, that could decrease the thyroid hormone to the point where the person now is showing signs of hypothyroidism. Radiation exposure, thyroidectomy, or if part of the thyroid gland is removed. Certain medications, pituitary disorders, pregnancy, and iodine deficiency. So that's just to name a few. Before we go any further, I just want to point out that both Graves' disease and Hashimoto's hypothyroiditis are caused by autoimmune responses taking place in the body. So these autoimmune antibodies that are produced, they attack the thyroid glands, and this is why individuals will be experiencing either of those two diseases. Okay, so I just want to clarify that. All right. Let us talk about the laboratory diagnostic tests that are done for both of these conditions. In the laboratory, the thyroid function panel is usually done to diagnose both hypothyroidism and hyperthyroidism. So the thyroid function test includes T3, T4, TSH, and usually T uptake is done to monitor the glands for hyperthyroidism. A T7 is a calculation that is done from those tests I just mentioned. So outside of the laboratory, then there is thyroid scans, for example, CT ultrasound that is done on the gland. And most of the times when an individual gets a physical, you may be aware that the doctor usually feels your throat, both sides of your throat with his hands. What he's doing is really an examination of the thyroid gland and so on. So those are the main tests that are done. In some conditions of hyperthyroidism, there's an antibody called TSI that is sometimes stimulated by the nodes in the thyroid gland. So that there is also a test for that. And I think those are the basic tests that are done. There might be others from time to time that the doctor will. Those are the main tests. Now let's talk about the treatment for hyperthyroidism. There are several treatments. One, there is surgery, and that type of surgery is called a thyroidectomy. And in that surgery, all or part of the thyroid gland is removed. And this will help with the overproduction of thyroid hormone, okay? So that is mostly what is done. There are different medications such as beta blockers, also radioactive iodine can be given. When radioactive iodine is given, what it does, a patient is given a capsule and they take it and it gradually destroys the thyroid gland. Patients who take radioactive iodine needs to consult their doctor to monitor their calcium level, their serum calcium, or to be given supplements or medication that helps them to assimilate calcium, because that test, removing the thyroid glands, interferes with the calcium production. Okay. Let me see. I think that's pretty much done for patients on hyperthyroidism. Now, the patients that are having problems with hypothyroidism, in this picture, viewers, you'll see a thyroid gland that has a cancerous growth. So some of the times when thyroidectomy is done, it's because of cancer and not because of the Graves' disease. In the next picture that will be coming up, you will also see a picture of the thyroid gland with a lot of nodes on it. And as I mentioned earlier in the presentation, that these nodes can produce a type of antibody called TSI that mimics TSH and cause the the thyroid gland to produce a lot of thyroid hormone. Okay, so bear that in mind. Now, the classic type of condition that usually was associated with thyroid disease was goiter. And goiter is an enlarged, swollen thyroid gland that was once a problem. But now, in our day and age, where iodine is added to salt, table salt, we don't see a lot of that problem. Most of the goiter that we are seeing is not because of lack of iodine. It's mostly problems with the thyroid gland. All right. So in hypothyroidism, the treatment is usually synthetic hormone therapy. And there is a lot of drugs on the market that may be selected. For example, there's levothyroxine, Synthroid, and so on that are normally used for treatment. One thing is important that I want to make you aware of, subscribers and viewers, is that if you have hypothyroidism, you should not let it slip by and not do anything about it, because hypothyroidism can also develop into a condition called myxedema. And that condition is a good condition, to put it in simple terms. It involves edema, swelling of different parts of the body. It can be the legs, around the eyes, the tongue, throat. Patient usually have this puffy type of face and so on. So it needs to be taken care of. So not because it's not hyperthyroidism that you say, okay, it's low thyroid. That is just as important. All right? Okay. There are a lot of complications associated with Hashimoto's hypothyroidism and Graves' disease. I'm going to list just a few. Let's take hypothyroidism first. So, complications such as loss of consciousness, tachycardia, slow heartbeat, osteoporosis problems, atrial fibrillation, shortness of breath, those are associated with hyperthyroidism. hypothyroidism. There is enlarged thyroid glands and goiter. There's obesity. There's infertility. There's heart disease such as bradycardia, memory, and there's peripheral neuropathy, and that usually tingling in the finger, and there's also weak. Let us talk about the foods that are good. Let us talk about the foods you should eat if you have hypothyroidism. And naturally, since hyperthyroidism, you have a lot of thyroid hormones, TSH, T3, T4. Naturally, you're not going to eat a lot of these foods. You will eat some of these foods, but you don't need to stress eating these type of foods. For the thyroid gland to function, it needs iodine and it needs foods rich in selenium. So these foods are found to provide those nutrients. So seafood, that includes seaweeds, salmon, any kind of wild caught fish is good to provide you with iodine. Other wholesome foods you should eat to increase your levels of selenium and iodine would be green leafy vegetables. But some professionals warn against eating a lot of green leafy vegetables. So eat a moderate amount of those foods. You should eat spinach, bone broth, garlic, walnuts, blueberries, Brazil nuts, coconut oil or the coconut that you pick from the tree fresh. I think that is good to eat too. Pumpkin seeds, eggs, and of course, you should buy the type of salt that has iodine in it. Now, for the individuals who have hyperthyroidism, they could take the salt that doesn't have iodine, and they should also stay away from taking aspirins, or at least seek their doctor's professional advice before taking a lot of aspirins. So that's just a few right there. There are more foods that I could include, but off the tip of my head, those are the ones I remember right now. Okay? In closing, ladies and gentlemen, let's recap what we covered. So we talked about hyperthyroidism and hypothyroidism, and both conditions are autoimmune conditions. Hypothyroidism is an underproduction of thyroid hormone, while hyperthyroidism is an overproduction of thyroid hormones. We talked about the symptoms, signs and symptoms, and the diagnostic tests, as well as treatment and causes of both diseases. We also discussed types of foods, for example, seaweed, iodized salt, eggs, seafood, wild caught salmon, spinach, and so on, that are good supplies of iodine and selenium, which are two nutrients needed by the thyroid gland. We talked about conditions that can come about by thyroid disease, and we talk specifically about Hashimoto thyroiditis and Graves' disease. There are others that are not listed here. For example, de Quervain's disease, which is a secondary disease that it's not really because of malfunctioning of the thyroid glands, but it happens secondary, and then that the condition is triggered. We also have myxedemia, and I said earlier, if your hypothyroid condition is not monitored and you don't get your medication, you can go into myxedemia, or a type of coma, in which you're retaining certain fluids and so on in your body. We talked about the tests, TSH, T3, T4, T uptake, total TSH, and so on. Those are tests that are usually done in the laboratory. I also touch base on the other diagnostic tests, such as ultrasounds, that are used. And we talked about surgery as one of the main treatment for hyperthyroidism, usually a thyroidectomy, which can be a partial or a complete removal of the thyroid glands. Some of the medications that are given to treat the condition were beta blockers, and we have other anti-thyroid medications. For hypothyroidism, I mentioned that Synthroid is usually the medication the patient is placed on. What else? Goiter. And you have seen in some of these pictures how goiter can really deface a person's body. That's what I'm going to term it as. This big swelling at the throat. And we also saw in hyperthyroidism how the eyes can protrude from the socket. So, to say the least, it is important to get medical aid if we have any of those conditions, and to take our medication and find ways to help keep the disease in check, such as eliminating alcohol and smoking and so on. The main signs and symptoms is what I want you to take away from this discussion. And for hypothyroidism, I mentioned that there is intolerance to cold, there is weight gain, slow metabolism, brain fogs, slow heart rate, constipation, memory loss, eye problem, dry skin, tingling sensation in the fingers, brittle hair, dry skin. What else? Those are just a few. Now, for hyperthyroidism, I mentioned that patient usually is hyperactive. Patient has diarrhea. Patient, let me see some others that I said. What else? Fast heart rate. Yes, that was one of the symptoms. The patient has tremors. Patient would also have profuse sweating, hot flashes, mood swings. I think I remember. I think I mentioned weight loss. irregular periods, what else? Hypertension, increased metabolic rate, prominent high, swollen thyroid gland, vomiting, nausea, diarrhea. Those just a few. And those are what I want you to take away, because those are going to be the things that you'll notice in yourselves and your loved ones to further give you an eye opener that you need to go to the doctor. All right? So that's the discussion. Now, if you have not done so already, I would like you to subscribe to the channel, to share the channel, tell others about the channel. This channel is not about making money. There is no monetary gain from this channel. This channel is a service that I would like to provide to help us to understand the medical conditions around us and for us to seek medical treatment before it's too late. Okay? So give the video a thumbs up and I'll see you in the next video.